We asked you on Facebook why you might not want to get the COVID-19 vaccine. News 3's Madeline Parker spoke with a local physician to go over some of the questions you have about the shot.
Julie, I'm here today with Dr. Jeff Ripperda, a Murfreesboro doctor who's been recommending the COVID vaccine to his own patients for months now. He's here today to help alleviate some of the fears that our viewers have about the COVID vaccine. Dr. Ripperda, thank you for being here today.
Thanks for having me.
Well, the first question I have is some people are concerned because the vaccine doesn't have FDA approval yet. So what do you have to say to that?
I think it's a fair criticism of the FDA to ask why they haven't approved it as of yet. Typically, the FDA requires 6 months of studies on a medication before they're going to go ahead and approve a drug for full usage. We have way more than 6 months of data on all of the COVID vaccines that are approved in the United States right now. The FDA is being a little slow, though, because there's so much research going on with the vaccines that they keep waiting for more and more research to come out. So I actually think it's a little bit of a criticism that I have of the FDA to say, hey, you guys really should have approved this by now. There's no reason not to. But just remember, the FDA approval doesn't really change anything. The vaccine still is what it is. If the FDA approves it, it doesn't change what actually goes on in your body if you get the shot. So it's nice when the FDA approves something, but does it actually change how the vaccine works? No, it doesn't.
And some people say that the research was way too short on this vaccine.
So I think what you have to understand about how a drug is approved in America is that typically, again, 6 months are required of study of the medication before the FDA is going to say, hey, this medication is approved and safe to use. For the COVID vaccine, they shortened that to just about 3 months, give or take. But that's because when the COVID vaccine was approved, there were about 3,000 people in America dying every single day. That's the equivalent to the number of citizens we lost at Pearl Harbor or the number of citizens we lost at the 9/11 terrorist attack every single day to COVID. So I would argue that it would be foolish of the government and of our health officials to wait the full 6 months when you're losing 3,000 people a day. And it's not like there was no data on the COVID vaccines. The vaccine had been studied in tens of thousands of people for several months to that point when emergency approval was granted. And at this point in time, the COVID vaccines are the single most studied medications in human history. So to say that there's not enough study out there, if you compare the COVID vaccines to just about any other medication that you or any other human being has ever put in their body, we don't know as much about those medications as we do about the COVID vaccines.
All right, well, thank you, Dr. Ripperda, for being with us today. It was a pleasure as always. And for more information on frequently asked questions about the vaccine or where you can get your first dose, you can visit our website at wsiltv.com/coronavirus. In the studio, Madeline Parker, News 3.